SERC offers different programs, and both Knowledge into Action project and ourselves, our doctor's program, have some similarities in a way that they both work with African newcomers in Winnipeg, and they both have components on increasing knowledge and increasing capacity among community members, and also to share in sharing knowledge with service providers here in Winnipeg.
For Knowledge into Action program, we work with African newcomer communities to increase knowledge in the African newcomer community on STBBIs, increase also prevention and stigma reduction. We work also with leaders and community resource people to increase their capacity to facilitate or disseminate HIV and STBBI stigma reduction message and prevention message. And also we work also with service providers to increase their knowledge in working with newcomer communities. Before we start, we did a needs assessment. Based on the needs assessment and the identified gaps, we hear many times the same question: is there HIV in Canada? Because people don't see signs, big billboards and signs that talks about HIV and HIV prevention. And sometimes also, especially refugees, also before they come to Canada, they go for tests. So it gives also an impression that everybody is tested in Canada, so HIV is not, doesn't exist, or it is not a problem anymore. Based on that, so we developed the program. When we are working in the project, always we collaborate with the community, so that we need the community's involvement and engagement in every level of the project, from the start to the end. For example, when we are setting our sessions, we do on when the community are available, on the places where they feel safe and choose, because first, like to discuss HIV and STBI is a taboo subject, and sexuality is also a taboo subject. So it requires a safe environment to discuss. Our program is delivered sometimes in first language and sometimes also with interpretation. The curriculum is also developed in partnership or in collaboration with the communities. We start our session with HIV 101 information, the basic HIV information, in a way that creates a dialogue through case scenarios, true false questions, role plays, demonstration of also the video. So it generates also lots of discussion. We try to address also in a way it doesn't threaten the community. In a way, people feel not judged, but it generates also dialogue and discussion. And we have training also to the community resource people. And community resource people, they will be trained for 4 years, like different topics that helps them to improve their capacity. And in all our sessions, also they participate in co-facilitation with a plan, like for them to facilitate sessions in year 5.
People who come, they have to attend the 3 sessions. We call it a series. When people complete the 3 sessions, a series of 3 sessions, they are complete their program. But behind that, we have yearly program that we call all our clients who are available to attend. Anytime there is a new information, we usually have opportunity when we call a multicultural session. For example, the law has changed about HIV. There has been maybe a new thing like, okay, there is now PrEP. So we usually organize events, or when we have a guest speaker who have a new information. For example, when we invite Legal Network to come to speak a new matter concerning HIV in our program. So we usually launch an invitation to everybody, and people usually come again. The efficiency of the Knowledge into Action project is related first to the acceptance of this project in the community. It's a community-based project or program, and we try as much as possible, first of all, to involve them in the way that's culturally fitting them, So in delivering this program, we deliver with a mind of cultural sensitivity and cultural safety. And we take it as a pillar of this project is to build a trust relationship with community leaders. By community leaders, we understand natural leaders, religious leaders, who are the people trusted and heard by their fellow community members. So by working with those people, they help us as a bridge to reach directly the community, and the community give us that trust because we are connected to them through their leaders who are trust and hear.
In Knowledge into Action project, we have 3 different components, and each one has different outcomes. So in Objective 1, we work in increasing knowledge and reducing stigma related to STBBIs among our African newcomer participants. We have specific sessions for adults and for youth. We have also an event that is offered to multicultural leaders, and the idea is to observe that they present increased knowledge. And we have also a medium-term outcome, that is this knowledge being applied in their communities towards stigma reduction. So the second component would be about capacity building. So we have sessions, specific sessions for community leaders, and each year is a different community that we work with. And we also have another series of sessions that is for community resource people. And these are the same people from the beginning to the end of the project. The outcomes for this component would be, as a short-term outcome, we want to observe that participants present increased capacity to discuss about STBBI prevention and treatment and stigma in their communities. And as a medium-term outcome, we would expect to hear from them that they are using this knowledge to support others in their community somehow. The third component would be with service providers. So it is a way that we have to share all the knowledge we have with the participants. We share with service providers in Manitoba and more specifically in Winnipeg. So expecting that they will learn more on how to provide a safe space for members from these communities and help them with giving proper information about HIV without stigmatizing them. So we learn a lot from the participants about stigma that they suffer and challenges that they suffer when accessing health care system. And so we do like thematic sessions about these learnings, and then we measure knowledge, and after a while we contact them again to know about our medium-term outcome, that would be if this knowledge is being useful in their practices with newcomers in Winnipeg. We truly believe that by giving information, providing information that is accurate and scientific, people, and giving the proper space for discussion, people will take their best decisions for their own lives and bodies and their communities. Knowledge into Action project, for each of the outcomes, we have indicators and different tools to measure them. For Objective 1, that is increased knowledge, we have a knowledge test that is made at the beginning of each series and at the end of each series. We code the forms and we compare the results. The knowledge tests are based on true and false questions. We have, I think, 10 questions, and it depends a lot from group to group. But what we see that groups start from 30-something% to 60-something%, and at the end they have like 80%, 90%, so it's a huge improvement. For Objective 2, that is increased capacity, we have a form in which participants rate their confidence in different aspects at the beginning and at the end of each series. For service providers, we have kind of the same. They rate their skills at the beginning and at the end of the session, and so we compare, and we are expecting a percentage of increase. these are the short-term outcomes. For the medium-term outcomes, in objective 1 and 2, that is increased knowledge and increased capacity, we do a focus group after 3 to 6 months. We get together and we discuss how they applied the knowledge, if they did, if not, why. For the community members, it is about if they apply the knowledge in their lives, about if they're about stigma. And in objective 2, that is capacity building, is more about supporting others. And then for service providers, we use some technology. We use like an electronic survey, and after also 3 to 6 months. So we basically ask, did you use information from the session in your practice with newcomers, and how? And that's, the analysis is done based on that. What I hear from participants is that we never had this information before. We never had a safe space to discuss that before. It's taboos among many communities, and sexuality is a taboo, so nobody talks about sexuality. When people say that they never had this opportunity before, it is something that really shows us that we are in the right path. Also, when people tell us a thing that was not even expected, we are a local organization. We expect that people can act here in their communities, and when we hear from them that they are already sharing their knowledge with people in Africa, it is very meaningful for us, because they are already doing much more than we could imagine. And they say like, oh, if I knew that before in Africa, I could have made so much difference there. Why don't you go there? Why don't you send the facilitators there? And so you see how the need is so urgent and so important, and the impact in awareness that we're doing.
Knowledge into Action program can be implemented anywhere, but provided that some factor be respected or implemented well. Saying that, we may look in terms of time, in terms of trust, because this is a community-based program. As I say, we try to work with a mind of cultural sensitivity and cultural safety. So those two things should be implemented as well. And the people who run the project should understand very well the community they're working with. And behind that also, it requires some knowledge. Knowledge about STBI, the trend of that disease, the effect of that disease, and how that disease affects the community you are serving. Having someone who knows the first language for majority of people serving, it will be also an asset.